glad you're here. Some of you guys look very familiar, and I've seen you around the clinic, so that's awesome. This is the best thing you can do for your health. So the fact that you are starting now, I'm very passionate about this, but what you do during pregnancy affects you when you're 40, when you're 50, 60. Because if we can learn how to utilize our pelvic floor, learn how to utilize our core, we have much better outcomes in the delivery room. So welcome. Hi. So I teach this to OB nurses, all at local hospitals. I teach this class to many pregnant women. And really, it's my mission just to teach people how to breathe baby out, protect their pelvic floors, learn how to coordinate our pelvic floors in order to have less traumatic births. I know that we can not have a 30% C-section rate. There are times that we need to have C-sections, and they're there for a reason, but they absolutely are overdone. And I think the more that we learn how to connect to our core, learn how to connect to our breath, the easier we'll have as far as delivery goes. You'll have faster recoveries, you'll have less tearing, less vacuum assists, and less C-sections overall. The least amount of interventions we have, the better the recoveries. The less scar tissue we have, the better our cores can just kick back on postpartum. So I'm glad you're here, investing the time. We're going to go through some anatomy stuff. So we'll learn about some body changes that you might already be experiencing. Who here is in their first trimester? Awesome, welcome. Second trimester? Okay, third? Awesome. Not yet pregnant? That happens too, just to prep. Cool, okay, awesome. Well, welcome, and we'll get started. So first off, I just have to tell you that it doesn't matter if you've had one pregnancy or 15. Every single pregnancy is different. How our bodies carry is different. But what matters is when you are connected to your body and to your core, it does not have to be, you'll have a better likelihood at being pain-free. And so what I'm going to teach you tonight will help keep you pain-free during pregnancy, but it will also help you in the delivery room. So it's a little bit of a double whammy, because if you are having pain during pregnancy, a lot of the time your pelvic floor is just tighter. And so your core is just not as effective. And so if you are having any SI joint pain, any pubic bone pain, any incontinence already, or urgency, having to go all the time, those are signs of pelvic floor dysfunction. And that would be a time where it's like, you definitely know that you need pelvic floor physical therapy. A lot of the stuff I'm going to talk about tonight will help you on that journey and help you get in touch with your pelvic floor, help you heal some of that dysfunction. But what I'm talking about isn't necessarily what you're going to find at your general pelvic floor physical therapist. We have what we call body motion birth preparation protocols, and they're specific trainings for the pelvic floor so that we can train the pelvic floor to be extensible, soft tissue, so that the uterus can do its job in really helping push baby out, and you don't have to push for hours. Because how many times have you maybe already been into the delivery room and or have friends or you see on TV, like, hold your breath and push? It's super common. Like, that's what we're taught. That's what I was told to do in my first 2 pregnancies. And it created massive amounts of tearing and massive amounts of prolapse. So prolapse is where bladder, rectum, or uterus can descend down into the vaginal canal. And a lot of times it stays with you the rest of your life, or at least some of the symptoms do. I'm sorry, at least some of the positioning does, but the symptoms don't have to. So the better that you get connected, the better your results are, that you won't experience that stuff. We have a ton of patients that are OB nurses because they see our clients deliver in the delivery rooms and they want to know what they're doing. And truly, the difference is when you can train your pelvic floor to open, so not close, but train your pelvic floor to open, you will straighten the chute of the vagina, so like where baby comes down and out, and you won't have to push through this like tight and squeezed situation of a vagina / pelvic floor. It hurts. yeah. And it can take a really long time. So let's get started. I'm going to teach you a little bit about the core. This will be interactive, so we're going to do some of the exercises together. But the core itself is your pelvic floor. So this is the bottom of your core. The top is your diaphragm. So the diaphragm sits underneath so rib cage here. Your rib cages might have already started to expand. So you might notice that your bra sizes are already getting bigger. That's totally normal. That is the rib angle expanding. That's your diaphragm straight, like flattening out a little bit. That diaphragm needs to move every time you breathe. So when you breathe into your belly, that diaphragm is descending into the belly. What happens is that the pelvic floor, the bottom of the core, needs to open and descend when you breathe like that. So they move together. So we're going to do some breath techniques. Actually, let's just start now. Then I'll do some more anatomy. Let's have everyone, you want to stand up with me?
Yes.
Okay. We'll put a hand on belly, hand on chest. Your goal is to not let the hand on the chest move, but to let the air fill the hand on the belly. So take a really nice deep breath into the belly. What you're feeling is that diaphragm descending as the lungs fully expand. Let the air leave the body. Go ahead and exhale. Okay, we're going to do that again. You're going to inhale, fill your lungs completely, pull that air down into belly. Try to really drive it down into belly, soften the belly. Exhale and let it go. Chest isn't moving a whole lot. Good. What needs to happen next is we're going to connect down to our pelvic floors. We're like already getting comfortable with each other. So I want you to think about your vagina. So connect to your vagina or connect to your anus and give it a little squeeze. So if you squeeze it, that's a Kegel, just to bring you a little sensation there. Most people are already semi-contracted and you don't really need to be busting out Kegels during your pregnancy. It's just the opposite of everything we want to train. And so what happens when you breathe in with your diaphragm and you fill those lungs, that vagina and that anus need to open and expand when you inhale. That is natural movement. So that should happen every time you breathe. Most of us have some level of stress, or we were just never connected to our vaginas in our pelvic area. Like we're taught to cross our legs and like close everything off, suck everything up and in. That tightens the pelvic floor. Add on that maybe some trauma, stress, like anger, like whatever it is, the pelvic floor stores that and really just stays tight. So we don't have naturally a ton of movement. Most people don't, unless you're maybe a professional singer and you're very connected to your pelvic floor. It's something that should be taught in like elementary school, like simply how to poop, how to pee. You guys can sit down now. And if we're connected to our pelvic floor, then we know how to use it. So we're going to do that breath technique. I'm going to stay standing for a minute. I think everybody can see that's online. Okay, so we're going to put a hand on belly again, hand on chest, connect down to, let's go anus first. Some people have better connection with the anus. I want you to think about inhaling.
I don't know what you mean when you say connect.
Mentally think about like what that muscle. So if you squeeze your pelvic floor or you close your anus like you're holding in a fart, that's a squeeze. That's a Kegel or a pelvic floor contraction. Our goal is to go the opposite way. I'm so glad you clarified. The question was, I don't know what you mean by connect. So connecting just means that you are mentally trying to find that muscle. So some people have a better chance at feeling it when they squeeze it. If you're like, lady, I have no idea what you're talking about. When you go home tonight, if you are comfortable touching your own body, put a finger either right inside the vagina or right at the opening of the vagina, and you can feel. Can you feel the squeeze? Can you feel the relaxation or the opening? So what needs to happen when you inhale, the lungs fill, the diaphragm flattens, the vagina opens, the anus opens, you exhale and let it go. So that's the breath pattern that needs to go through. Let's go through it one more time. So you're going to deep breath into belly, let the lungs completely fill. Try and drive that air into the low belly. As you inhale, that vagina is opening, the anus is opening. So you're imagining if the vagina was a rosebud, you're trying to blossom it to see all the petals of the flower. That's the move. And this can be a hard area to connect to. And if you're like, I really just can't feel it, then just start breathing this way. Just start breathing into your belly. 5 minutes every single day is going to help train that diaphragm to descend. So when I said like the diaphragm is that top of the core and it's starting to flatten out because your ribs are expanding, it's getting weaker. So as the ribs expand and the diaphragm gets longer, it gets weaker because it loses what we call a length tension relationship. That doesn't really matter, but just know that like it gets weaker. So the way to train it so it gets stronger is by doing this type of breathing. You might be like, how is this even an exercise? But it truly is. Like doing like intentional breathing exercises is completely a very good exercise for the top of the diaphragm. And then it will eventually drive into the pelvic floor. What happens for a lot of our clients and like really what we specialize in is helping open up the pelvic floor, because sometimes breathing isn't enough to get that extensibility. If you think about the pelvic floor has to like really open for a baby's head to come out here. As the cervix dilates, so you have your uterus here, you're contracting, then you get the cervix to dilate. That's why you're getting those contractions. And as it dilates, it also has to descend down into the vagina. But if the pelvic floor is super tight, then you're working against a cement wall. And time again, if I could change the world, this is honestly what I would do, you guys. Every single freaking person who is pregnant would have this type of work done on their pelvic floor to make this like a squishy, soft, nice, hydrated muscle that can totally stretch. This is what we do with our clients. And it makes all the difference, because then you literally can just do that breathing that we just did together. And then you just breathe baby out. And sure, could you tear still? Yeah, maybe the baby catches a fingernail on the way out, but it's like a very small tear. It's not like you're getting these like massive second, third degree tears of the perineum when you train this muscle. It's kind of like this, a really healthy pelvic floor. Let me just PS this, because if you do this before menopause, not that you care about that right now, but like I'm perimenopausal. So like if you do this work now in pregnancy, this sticks with you. Like you get this healthy now, like, yeah, sure, you still have to recover postpartum, but it stays with you. And then all of a sudden, like you have this motion of your pelvic floor. And for a healthy core, if you're running marathons, working out at the gym, or even just walking with your babies, like your pelvic floor has to have this extensibility. It has to be able to open and close. It's like a slinky. So every time your foot hits the ground and you're walking, it is the shock absorber. Everyone who has a frozen pelvic floor that doesn't have that movement, it doesn't get that shock absorption. So that goes into the knees, the hips, the SI joint. And so you end up with women with years and years of pain, cortisone injections, joint replacements, because they've worn out their joints, because they don't have that natural shock absorption or natural core control. Because, oh yeah, go ahead.
Is the pelvic floor the whole thing that you're holding up, or is it just like the soft tissue?
The pelvic floor muscles are the soft tissue.
So it goes from like the vagina to the anus?
Yeah, it's a bowl.
Okay,
yeah.
Sorry, I just wanted to be
perfect.
clear.
No, let's go.
Sorry to interrupt you.
I love it. I like got a little carried away.
Oh.
I get very passionate about it. But this is the pelvic floor.
Okay.
It also contains like your skin, your nerves, blood vessels.
Okay, but it's not the bone.
Your lymph. No, these are your pelvic bones.
Okay.
It sits within that.
Okay.
The bones loosen up during pregnancy, and because of relaxin and progesterone. So have you guys heard of relaxin? Okay. Relaxin is that muscle or that hormone. It can be like full blown at 6 weeks. So even if you like have a miscarriage later on, you still have all the effects of relaxin in your body. So it still like is very much like you have to recover from that, because relaxin is very potent in how it makes our joints flexible. And for good reason, like we need it to happen. It's not just specific to the pelvic joints. It happens in the entire body. It makes everything more flexible. So you are a little bit more predisposed to injury when you are pregnant, just because of the joint flexibility. So just keep that in mind if you're trying to like ski this season and whatnot, or do some kind of contact sport. That's why they don't always recommend it. But this joint, the pubic symphysis, it spreads 6 to 9 millimeters during pregnancy. Well, 6 to 7 millimeters during pregnancy, but up to 9 during the actual delivery itself. Sometimes people get pain in this joint. It's called pubic symphysis pain. And there's a lot you can do for pubic symphysis pain, but if you are getting pubic symphysis pain, then that means that your pelvic floor is in a literal spasm, contraction, trying to hold that joint together. So all the more reason to learn how to open the pelvic floor, get the extensibility within this pelvic floor. Does that answer that question?
Yeah, sorry. I just wanted to be clear on what the pelvic
Yeah.
floor was.
No, that's really good question.
Before like you moved on, because I wasn't sure.
Yeah.
I know it's like probably everybody here knows, but I
No.
wasn't sure.
It's so good. The anus is inside the pelvic floor.
Okay.
So all pooping, farting, all that stuff. The vagina is inside the pelvic floor. The clitoris is inside the pelvic floor. The urethra is inside the pelvic floor. So everything with like urination in the urethra, anything with like intercourse inside the vagina, anything with bowel movements, farting.
So the
leaking
bladder
gas.
is too, or no?
Yeah.
Oh, the
Yeah.
bladder's part of it, and
They're the organs that are on top of the pelvic
Okay.
floor. Yeah.
Okay.
So that's why this is like so important.
Yeah.
Because it affects every single hole, and there's a different doctor for every single one of these holes. So no one really ever like puts together how important like treating the actual pelvic floor
Yeah.
is, because you literally have a colorectal doctor, an OBGYN, a urogynecologist, like you have every separate doctor. And so maybe that's a conversation for another day. But regardless, so that's what the pelvic floor is. So you want to protect its functions, because if you do have a tear postpartum and that is affecting you being able to hold your poop in or being able to hold your pee in, or even just have an orgasm. A lot of people struggle to have orgasms after they deliver. And it's like, it's because the pelvic floor is affected. So the more you get this conditioned before delivery, the better. And like the number one thing, like it's that simple, what I just told you. And we're going to do it again a few other ways. But it's that simple. It's like, just breathe. If you breathe using that diaphragmatic breath with the pelvic floor opening, if you can figure out how to coordinate that, then you'll be golden. And also you might not have the opening and flexibility that you need. And that's why you can definitely come see us at the clinic. So at Body Motion. But just at least start with the breathing, and that will help. Questions? Yeah.
This might be jumping ahead.
No, go
When
ahead.
you're having a contraction, then
Yeah.
are you supposed to do this breathing like whether you're in contraction or not,
Yeah.
or is it So then there's no coaching around push because you're just breathing normally through the entire delivery.
Yeah, I'm going to repeat the question. So you're asking like when you're having contractions or not having contractions, but if you're in active labor, should I breathe like this? 100%. And let me tell you why.
And so there's no difference then, because usually it's like, oh, now you get a break because
Yeah.
you're not contracting, and now you push, but that's not.
Yeah. So what we train you to do, so when people come to Body Motion for birth preparation, it's a lot of internal manual therapy. So it's literally a finger inside the vagina, opening up these pelvic floor muscles, creating new motion. And that might sound scary, but that actually makes the muscle so much stronger, because the more stretch it has, it's called eccentric strength. The more stretch it can get, the better contraction it can get, first off. So it actually makes sex way better. Yeah.
No, go ahead. I just heard of people like their husbands doing that for them, like to prep for birth.
Yeah.
I
So
don't know if it's like, but it's probably like they're not physicians, so.
yeah, there's something called perineal stretching, and we can talk about that.
Oh, okay.
This is different because we're getting all 3 layers of the
Yeah.
pelvic floor, and that's really where the important
Yeah.
stretching needs to happen.
Sorry.
No, you're good. You're good.
Eccentric stretch.
Eccentric strength. So what happens is if we can get that opening and that strength, you are just that much more strong. So a tightened pelvic floor is not a good, healthy pelvic floor. That actually usually means like sex is worse. That actually means that that's when you pee your pants. Like most people are like, no, I need to tighten it. I need to do Kegels. And that's not the case at all. Usually a tightened pelvic floor is putting a ton of pressure on the pelvic organs themselves, like the bladder. And so it's literally squeezing the pee out. And then a tightened pelvic floor turns to, this is a food analogy. So and meat. So cover your ears if you can't tolerate a meat analogy, but the pelvic floor is a muscle, right? So we want it to be a healthy muscle, which is like a juicy chicken breast. If we have a muscle that's like dehydrated, it's more like beef jerky. So it's more predisposition to tear, and we don't want that type of muscle. So the healthier we get, we want the pelvic floor to be the chicken breast. And how you get that is by doing this type of stretching and this type of extensibility work. And then we train that with the breath. And we train it in multiple positions depending on where you have the best control. So you can determine the best position for you to labor in and the best position for you to deliver in. That was a little side note. But let's go back to the core. So the core itself, I'm going to teach you guys another exercise. This will help prevent diastasis, so that ab separation. Has everybody heard of a diastasis recti? Okay, that's where you might feel like you have a hole in your belly, or when you do like a sit up, that you get a little bit of coning. At this stage in the game, I really recommend that you don't really do a lot of sit up work, and even getting out of bed. When you get out of bed in the morning or at night, like roll to your side and then push yourself up. You want to avoid that like crunching. But I will tell you, like the most times I see people give themselves a diastasis and know they feel like, oh, I just did that, is when they sit on their couch. So sitting on the couch at night is very hard on the abdomen, not just at night, like anytime. So when you go to sit on your couch, just use your hands. Like use your hands to really lower yourself slow, and then use your hands like you get the couch, right? Pretend. And recline back. What happens is a lot of people just like recline back, and then you're like, oh, I just busted it open. And so you want to use your arms as you recline back. Same thing coming forward. You want to use your arms. The other thing you can do is use your breath. So when you are doing anything with exertion, you're exhaling the air. So if you're reclining, you're shh. If you're leaning forward, you're shh, but using your arms. That's going to help just pull things in a little tighter. Mm-hmm. Activating the transverse abdominis muscle. Do you guys know what this muscle is? Heard of it? Yeah. Okay. Let's stand up and do it together. So this is the muscle that if you can activate this will help prevent that diastasis, or at least keep it at bay if you already have one. So it's right inside your transverse abdominis muscle, is right inside your hip bones here. And you can kind of put your hands there, and you should feel like if my belly's totally relaxed, you should feel when you engage that muscle, that the muscle comes in and up towards your head to get some activation there. And that's contracting the muscle. So you're not like full on bracing your belly. You're not flattening your back. You're not doing any of that. Your spine should be totally neutral. Like nothing should move. And all you're doing is pulling that lower belly up and in and holding that for 10 seconds. 10 seconds, 10 times, once a day. That's all. Golden. It's really that simple. Yeah.
Can you show that here?
Yes. Yeah.
Okay.
So if you're here and belly is totally relaxed, and I'm just pulling up and in, like I'm giving baby a hug. And just like activating those little muscles, let it go. Pull baby up and in. And you try to keep your butt cheeks totally relaxed as you do it. If you get really good at this, you also want to try to keep your pelvic floor relaxed as you do this. If you can keep your pelvic floor open, that will help prevent the pelvic floor from tightening and contracting more.
What was the name of the muscle again?
Transverse abdominis muscle. So we also have a whole online birth prep program. I think someone's winning it tonight. And I go through a lot of these specific exercises that are preventative in that program too. So let's go back to, let's now sit down, but don't sit down together. Like don't wait 1 second. So one way to help keep the pelvic floor more open during pregnancy, as your pelvis is like getting more loosey-goosey, is to sit down on your actual sit bones. So much of the time we sit in like this like rounded posture, but that puts so much stress on the pelvic floor and just causes like more tightness through the pelvic floor. So what I like to say, I'm going to turn this way and then I'll turn the other way, is when you go to sit down, it's a little awkward. You don't necessarily have to do it in public, but you can, is you stick your booty all the way back And then you lift your butt cheeks up if you can reach. And then you sit down right on your sit bones. And then you can stick some pillows behind your back to like make sure that you're fully supported. You shouldn't have to feel flashing the camera. You shouldn't have to feel like you're fully like holding your posture up. And that's where if you use support behind your back, that will help keep your spine nice and aligned, and that will help prevent you from like going into this slouch. Does that make sense? Okay, so try it now. I'll turn this
Sorry
way.
for the person behind me.
No one cares. We all do it. And do this postpartum. Like this is important, not just now, but postpartum. Like you want to be sitting on your sit bones. It will unload your pelvic floor. So same thing. So lift the booty up, and you have to kind of train it because like when you're pregnant, like it's hard to get lift because your glutes are usually like so tight from trying to squeeze the pelvis and keep the pelvis together. So we want to prevent that too. So we want to loosen up the glutes. Everything that's attached to the pelvis, just think it needs to be chicken breast muscles. Like it has to be soft, it has to be extensible. And that's what we work on in clinic. It's just like everything that's attached to the pelvis, we balance it so the pelvis can open symmetrically during the labor and delivery. And then we want everything to be able to stretch, because the more it can stretch, the more it can come back together without a ton of damage and intervention.
Yeah.
Makes sense? Yeah.
So that totally makes sense.
Yeah.
But just, I assume then that like lower back, hip pain, et cetera, is all interconnected as well.
100%. Yeah.
Okay.
If you have low back pain, if you have, what else did you say?
But yeah, like hip pain.
Hip pain, it's in the pelvis.
Yeah.
So that, if you have any of that going on, the body's natural compensation for that is to just tighten everything up.
Yeah.
And like
Harder
try to
down here.
hold it together. Yeah. So definitely come see us. Have a consultation with me so we can like get to know like what else in your body is tight, and like you probably like every single person would benefit from getting pelvic floor work done. So to say that like you need it would be, I think everyone should have it because it changes the game for delivery. But if you have pain, like all the more reason to have it. Certainly have it done. Okay, so this is the glute glide. Just one more time. I call it the glute glide. So you lift butt cheeks up, you reach them back and sit down.
I can definitely feel like me sitting on my bone.
Yeah. And so now when we're in this position, now try to do a nice deep abdominal breath. So let's connect down. You can put a hand on chest, hand on belly. I want you to connect to pelvic floor. So you feel, why don't you feel vagina, not physically, just mentally. Get there. And then you're going to take a nice deep breath into belly, filling the lungs, allowing the air to go in deep into the belly, keeping the chest nice and relaxed, opening vagina, exhaling, letting everything go. When you exhale, you will feel a recoil of the vagina and pelvic floor. And when you inhale, you'll feel an opening. It's just mirroring exactly what the diaphragm is doing. Again, don't feel bad if you don't feel this. It is a challenging thing to get, just because of the fact that like we hold like everything up and in, and it's a hard area to connect to. And that's why our birth outcomes are shit, to be honest. Like it's because like we don't have this type of training. We don't get this kind of pelvic floor coordination down. But yes, let's go into questions right now. Those were great questions.
I
Yeah,
just find it's easier to connect when I'm standing up. Like I can't feel as much as sitting down,
so
but I
good.
can like feel it when I'm standing up.
So that means that you're delivering standing up. Like, I mean, we'll check you obviously, like, you know, like, and figure out like your best positions. Like that's definitely what we'll do in clinic. Like once you're 32, 36 weeks pending. But we'll figure out like where you have the best opening. And if you feel it the most in standing, you probably have the best opening in standing. So it's probably advantageous for you to advocate or have like your partner advocate for you. Like I need to be delivering in standing, or I need to be at least laboring in standing. Now that will change if you decide to get an epidural. Like if you know
That's
you're
what I was
like,
gonna ask.
yeah, if you're like, I'm gonna get an epidural. In the birth prep program, we have a whole slew of like safe positions. We might even have that on YouTube.
Because this is all like stuff for non-epidural births, right?
No, this is epidural or non-epidural.
Oh, because when she was asking about like knowing when to push, I always felt like when I had my kids with epidural, then it was like I had to be told when to push, but when I had natural, I knew when to push.
Yeah, no, you have what's called, the epidural doesn't change
The
your
Okay.
the pressure. So
Okay.
you'll feel the pressure.
Okay.
It's more so just not having that connection.
Okay.
So
I just don't really remember so much. Like, it was like my first child, so.
yeah.
But I was just wondering about like if this stuff was, if you can do it during an
100%.
epidural.
It
Okay.
makes it, and like that's like when you were asking, should I do this during the entire labor? Absolutely.
Okay.
Because if you can stay locked in during your entire labor, and like whether you have an epidural or not, but you're doing this breathing, you're doing it during the contractions and not during the contractions. Because it's easy to get an not easy. Epidurals can be work or they cannot work, first off. And but like if you get the epidural and you're like, I get relief, you're like, oh, I can like check my phone and like do this, do that. But like if you can stay locked in on your breath and just stay true, it will help the progression of the delivery that much better. So it's just like that mental focus and clarity, because the diaphragm is if you can train your breath, and if you guys all felt your bellies get a little bigger when you breathe, when you inhaled, then when you are going through the delivery process and you are in labor, so even if you're just getting Braxton Hicks contractions, it's a great time to practice. This breath will never put you into labor, but it will help facilitate your labor because the diaphragm with every inhale is descending down into the belly. And when it descends down into the belly, so when you inhale, lungs are full and it's descending, it's pushing down on the top of the uterus. And so as it pushes down on the top of the uterus, it's just amplifying like the effectiveness of that contraction. So you're using your diaphragm to help bring baby down.
Okay.
But if you're bracing the contractions and you're not breathing or you're holding your breath,
Yeah, that's what I did with my.
they become way more painful because you're not breathing. When you're breathing, you get what's called vagal stimulation. So you get more of that like parasympathetic, relax, rest and digest state of being in your nervous system, which is what we want. Because if a tiger was chasing you or you're super freaking stressed, like you are not going to have a baby, that's like olden day stress. Nowadays stress, that's like hospital bright lights. That's people that you don't want in your delivery room.
Yeah.
That's someone saying something that didn't sit right with you. And so just like controlling your environment to whatever you can. If you're deciding you want to be in a hospital, then it's like, okay, I know that like I don't want this person in my room, or I'm going to pretend like I'm at a spa. So a lot of like during our birth preparation training, when we are training you, we mentally go to like those happy places. Like, where do you want to pretend you are, even if you're not there? And it's like, so if you're in a hospital and you don't like hospitals, like still just mentally be at the spa or like wherever you want to be, just so your body can be in that relaxed state. And giving yourself that ability to be locked in on your breath is very effective to help regulate your nervous system and keep you in that rest and digest phase. Because like what you'll see is like maybe someone will be laboring at home and then they have to drive to the hospital and all of a sudden they regressed and like a midwife maybe checked them at home, and then now they're like a lot less dilated because the car ride was stressful. So it's like just managing that stress and knowing that you just need that like you need to use your diaphragm to keep you in as relaxed of a state as possible. And so that's the double whammy, but it's also helping move baby down with each contraction that the uterus has. And as the uterus is contracting, it's just simply working to open the cervix.
So you can wait. So I just was wondering. You made me think of a question to ask. Can you be like at an 8 and then go back to a 7?
Mm-hmm.
I had no clue. I didn't know that. I didn't know you could go backwards.
Mm-hmm. Yeah.
So thanks for telling us
Yeah.
that.
Yeah.
Yeah.
Happened to me on my third.
And so that happens because you're tight? Or what
Usually
you get
it's
stressed?
like a stress response.
Okay.
Like body's like, oh, okay, not ready, not safe to have a baby anymore.
Oh,
Yeah.
okay.
So it's like,
Interesting.
and everyone has a different stress response.
Yeah.
But yeah. So, any other questions come up as we talk through that? Well, okay. So I think final thing that we should definitely go over before we talk about how to actually, we've really talked about how to breathe baby down. That's the breath pattern that we've gone through. And we'll talk about pushing in just a minute. But as far as, we're going to talk about bowel movements. So bowel movements happen through the anus, which is the backside of the pelvic floor. A lot of people have a lot of tension around the backside of the pelvic floor. The first thing that you should start doing is be aware of your body, whether you're doing dishes or laundry, when you're at home, standing for an elevator, whatever it is, check in with your butt. Like, are you clenching your butt? Are you squeezing your butt tight? If you're squeezing your butt tight, you're squeezing your pelvic floor tight. So the first thing you got to retrain is to not squeeze butt tight. Like, keep everything open, keep your glutes relaxed. Try to keep your glutes relaxed and use your lower abs to support your body and not your butt cheeks. Your butt cheeks are going to be really squeezing that pelvic floor. So, pooping. The best thing to do with poop is the minute you get the urge to poop, you want to go. Try to go within 15 minutes, and that's really important. If you're having constipation during pregnancy, talk to your provider about taking magnesium or taking something to help regulate that constipation. The more constipation you have, the more poop that you get that is stuck in your body, the more pressure that's just sitting on the bladder, and we don't want that. You already got a baby growing on your bladder. You do not need more poop pressure. So get that poop out as much as you can. Every time you have a bowel movement from here on to delivery, imagine like you were having a vaginal delivery, like baby is coming through birth canal. It's just the poop, but imagine that it's baby, because it's the same exact sensation. So if you practice this every single bowel movement until delivery, your brain is like, oh, I know that pattern. I know that this feels fine. I know that this is normal. This is safe. It's okay. But when we go into delivery and we're like, wait, is that what it's supposed to feel like? Baby's coming through. I've never felt that sensation. Sorry, just pro tip. That's another reason why to do pelvic work during pregnancy. It's just so you know what that feeling is. It's so important. And it takes someone skilled to do that. I don't know of a husband that can do that very well. But we teach husbands all the time. They come in to appointments all the time.
Oh, that's great.
But I would say